Be sure to check out the Younger You website to watch full episodes of the show. Stay up to date on the Younger You Challenge and get useful tips and tricks to help you achieve the Younger You. Welcome back. We've already been talking to Dr. Barson about plasma skin resurfacing and ultherapy. Now let's talk about Thermacell skin tightening. Dr. Barson, Thermacell, what is it?
Thermacell is one of the heating technologies. We talk about heating the skin causes it to contract and to tighten up. This uses radio waves. Now, most common thing that people know of this is a microwave oven. It uses radio waves to heat. Now, this is not a microwave oven. You don't put your head in a box or anything like that. It's done with a little tip, and it runs a radio wave through your skin, and it heats it.
Okay.
And it's that heating that makes a change.
I love that. So, of course, we've got Mona joining us now as well. Mona, did you feel like you were put in a microwave?
No, no, but it was a little warm. It was a little warm.
So tell me, Dr. Barson, how does this differ from the other two procedures we've already talked about earlier on?
The end result's the same. It's a heating technology.
Okay.
However, this one is much more gentle. You have to have a series of treatments, and so pretty much anybody can go through this because it's more like just sitting there and it's more relaxing. But you have to have more than one treatment.
Okay, that was my next question. What can patients expect when they have the Thermacell treatment?
It's like the other treatments. It's not going to be finished for up to 6 months.
Okay.
So that's how long it takes the skin to finish all of its remodeling and its healing. Some people see results more right at the beginning, and actually some people see results more at the end of the 6 months, which is kind of strange.
And you were saying that earlier on when we were in break. You said sometimes it can work immediately, and then when patients are going through the 6 months, you can get even better results towards the end. Mona, would you have the procedure done again?
Yes.
You would? Yes. You want to maintain it?
Yes.
Can you feel a difference?
I can see the difference.
You can see. What about feel? Because when you have skin tightening, I know when I've had things done in the past, I can feel this tightness on my face.
No, I haven't felt that.
Really?
No.
Fascinating. So when you say you can see it, what do you see with your eyes?
I see that the spots that were bothering me around here and right here are diminishing.
I love that. I love that. Well, we're going to go and see what the procedure looks like being done on you in Dr. Barson's office.
I am having Thermacell done today because I have some fine lines around my eyes and around my lips and around my smile area. The fine lines bother me really bad. It's just something you get up every morning and just go, oh, I'm 53, and it's just getting to be 53 years old, and then pretty soon you're going to be 63, so if you can take care of it now, it'd be better for the future.
With this treatment, what we're doing is we're using radio frequency to stimulate collagen and elastin in the skin. This procedure is called Thermacell, and a lot of people have heard of Thermage, which is an earlier technology of radio frequency. It's singular polar, and this is tripolar. The benefit to tripolar is it's less aggressive on the skin, and it doesn't have to travel through your body to a returner pad to deliver the energy. So it's more versatile for patients.
My girlfriend says, well, what is it going to do to your face? Well, realistically, I educated myself as well, and it's really just heat involved, so it builds the collagen underneath your skin. So you won't see the results right away. It takes anywhere from 3 to 6 months.
So she's feeling some vibration, some heat as we're driving that radio frequency energy into the skin. There's no downtime with this procedure. In some patients, there's redness and splotchiness, but no social downtime.
If there's something that you don't like about yourself, there's all the procedures that are out there. Let's face it, all the medical procedures now that they have has become more affordable. And so if there's something that bothers you, get it done.
So basically our goal is to keep the energy focused in one area for as long as possible until the skin gets to a certain temperature. And once it reaches that temperature, you've damaged the skin to the point that you are going to see tissue rebuild and grow.
Oh, my husband, he's very supportive. He just says, oh, I think you look fine. I said, you know what, I don't want to look fine. I want to look great. Because if you look great, you feel great. What I'm looking forward to the most is in the future, is because it takes time for this procedure to show. When I look in the mirror and I don't see those fine lines that just make me just want to growl.
Well, let's look at your before and after pictures here, Mona.
Okay.
So, Dr. Barson, the results here. What are you thinking when you see these before shots?
These are about what we'd expect. Now, this is not going to be a procedure that's going to cause tightening to the extent with like maybe surgery or a more invasive treatment, or one with a lot more downtime. But this is something for somebody that wants refreshment, and it looks better, but it's not obvious to anybody, and it has a very high tolerability index. People are not like afraid of this because it's not painful and hurtful.
Mona, when you see those before pictures, what goes through your mind?
I want to be a cheerleader.
Has anyone noticed the change on you?
Actually, my husband and my friends have.
Really?
Yes.
What have they said?
What are you doing to your skin?
Really? So you could do an info commercial for Dr. Barson.
I could.
And Mona, explain the sensation of the feeling of the procedure. What does it feel like when you're having it done?
It would get warm, very warm, sometimes hot in certain little spots, and then it just would go away. And wasn't very uncomfortable.
What were your expectations?
It has met my expectations.
Really?
Yes.
It's so funny because some people say, yeah, I had it done, but it doesn't really work that well. I love the fact that it has exceeded.
Yes.
I love that. Good job. Good job. Do you feel more confident? Do you feel like by having this procedure done that you're like, I can, take on anything?
Well, I think I feel like I look younger.
I love that. I love that. Why did you decide to have the procedure done?
So I could just leave the office and I could go back to work. It was not that invasive.
I love that. And when Dr. Barson was telling you about the non-invasiveness of it with minimal downtime, did you feel like this is the way I need to go? This is what I need?
At this time, it works for my schedule.
Would you think of having anything else?
Oh, absolutely.
What do you say to women out there that think cosmetic procedures are for people who are vain?
I say if it makes you feel good, do it.
I love that. Dr. Barson, what do you say to people when they say that to you?
It's very important for women to feel good about themselves. If they don't feel good about themselves, then the world is not right. If they feel good about themselves, they're bulletproof.
I like that, bulletproof. Do you feel bulletproof?
Yes, I do.
Well, you want to be a cheerleader now. That's what you were talking about.
See?
How long before you go in and have another procedure?
My guess is within the next month.
Really? How soon can you have them step by step, Dr. Barson?
Well, you can do these procedures once a week if you want to go through the series.
Wow. Well, we don't want her looking too.
Ask her.
I just like how she giggles. She just said nothing else. She just went, well, I sort of do want to look too.
There's nothing better than baby skin.
I love that. Well, we've covered a lot of material today. Plasma, Ultherapy and Thermacell. These are all great options if you are looking to tighten and resurface your skin. For more information about the show, please visit our website at theyounger.you.tv, and I'll see you next week. Next week on The Younger You, we'll meet Karen and watch as she has the fat sucked out of her stomach and injected into her face. The Younger You set provided by Madison McCord Interiors.